More research shows that seniors on Medicare are apt to be in potentially harmful high-risk medications when there are often safer alternatives where the benefits of safer substitutes often outweigh the risks of the prescription medications. Now, the Brown University study shows that 1 in 5 seniors that are on risky medications, and another study shows that seniors are on between 5 to 7 prescription medications a day. Now, if 5 people are on 5 to 7 medications a day, that's like 25 to 50 meds. So how can only 1 in 5 seniors be on a risky medication? This doesn't add up. I mean, do the math.
You're making great sense here. It's very simple. When you're looking at the danger of medications and the number of deaths and hospitalizations, and then comparing it to what's used with supplements and herbs, those numbers are staggeringly different. And the study Vicki was talking about was published in a journal called the Journal of General Internal Medicine, April of 2013. And basically, you're looking at 400,000 deaths every year from the use and misuse and mistakes that are made from medications, from pharmacological drugs. And when you look at the number of deaths there are from other approaches, like supplements and herbs, you're looking at somewhere around 50 a year. So what a good point this is, and how understated can a research study be?
And also, as we've talked about before, many times, you know, these medications that people are on, when they're on several medications, they can have reactions with one another.
Oh, for sure.
And nobody's really done those studies.
Oh, there's no question that there's very little science in use of multiple drugs in the same patient. If a drug company gets approval from the FDA to use a drug, they get the approval for it. But nobody has ever done a study on 2 drugs or 4 drugs or 8 drugs. Or look at people that are in convalescent hospitals or in hospitals, and they're taking 20 drugs at a time.
And most of them are on sleeping pills and tranquilizers and
well, the doctors don't want to be bothered,
confused.
so they have what are called standing orders. If you're constipated, there's something. If you can't sleep, there's something. If you're anxious, there's something. There's usually something for pain, something for nausea. And then these drugs are just given along with all the other drugs that are given. And I think that when you're talking about a number of 20%, it's way understated.
And isn't there, you were talking about standing orders, isn't it kind of routine for doctors to order that geriatric patients get statin drugs to?
Well, not as a rule, but if there's a problem, if the cholesterol is high, even if somebody's 80 or 90 years old, a lot of doctors are prescribing the statins. And of course, the side effects and complications of those in people who have not had a heart attack or a stroke are way above what's reasonable in terms of benefits versus risks.
Well, and then there are many other medicines too, but you know what I thought was that these authors of this particular study had the audacity to blame the elderly patients that are on these drugs, saying that they need to do the research and to figure it out.
Yeah, it's
I mean, what do we have our doctors and our pharmacists for?
Yeah, exactly. I mean, if there's a problem and we identify it, yep, let's put it on the patient and say it's your fault because you didn't do all the research to make sure.
And not only that, you know, a lot of people do look up things on the internet.
Indeed.
But most of the elderly don't even know how to use the internet, and if they do, they need a little help.
Well, now be careful.
I mean,
We're
I
kind
know
of
I
elderly
need
ourselves.
help. Well, I need help.
All right. Well, I feel like a geek because we do so much work that's in video. So for sure, we're overusing medications. We should be underusing medicines, and there's an order to which we should be looking at how we treat patients. It start with lifestyle always first. And it's the most powerful medicine in the universe as well. If that doesn't work, then we should be looking for non-invasive therapies, things like acupuncture and chiropractic and Ayurveda, Native American medicine, etc., etc. If that doesn't work, let's get aggressive. Let's look at a supplement or an herb because they don't kill so many people. And then if that doesn't work and we're having real problems, of course we want to look at medicines and surgeries. So this study underestimates things for sure. But the real bottom line here is the whole system needs to evolve to one that makes a lot more sense, that has a lot more regard for safety and what we can do ourselves with a healthy lifestyle.